Hello everyone and welcome to Time with Dr. Racheal. Thank you guys for subscribing to our channel. Wow, I can see all the likes and the loves. We love you too. And particularly glad that we're able to talk to people who actually want to hear these things. Honestly, I didn't know that a lot of people were interested in the things that we're talking about, and I'm glad to be at your service. Let's put it that way. In our last video, we talked about endometriosis. I know some of you will be wondering what this means, so you could check and click on it so you can see what we did before, and we even have other videos on other things about women's health and sexual and reproductive health. But this week we're going to talk more about how can we manage endometriosis. What does it mean? Plenty words, Abby. That just means the cells in the lining of your womb deciding to leave where they're supposed to be and grow elsewhere. At the back of your womb, in the lower part of your womb, in the lining, everywhere they just decide. Or even inside the muscle, and then we call that adenomyosis. So those linings, they should mind themselves. So so that's it, right? Now, how can we manage it? For some women, simple pain reliefs for the management of the symptoms. But the real problem is you don't want those cells to continue to grow. So there are medications your doctor will prescribe to help to halt the growth. The truth is, if you're not menstruating, you're not having the pain as much, and it's not getting worse. So there are some drugs that can help to modulate it. There are instances where you have what we call an endometrioma. That means one endometriotic cell that decides to grow in its cocoon, so to say, on your ovary. And it's causing appreciable pain. Through procedures, we call them pinhole surgeries, you can go in and get it resected, taken out, cut it out, and that's it. That's simple. But overall, you need to know, what do you want in terms of life expectancy? What exactly do you want in terms of treatment? What are your treatment needs? So it's like a tailor-made treatment needs. From other people, like I mentioned in the last video, it could be a cause of infertility. And I said it again, and I'll say it now, that endometriosis, if you have endometriosis, it does not mean that you will be infertile. There are women with endometriosis that have their own babies normally, but it is also possible that when you come for infertility, that means you're not able to get pregnant, and we check, we can find out, just maybe the fact that you had endometriosis could have delayed the process, and then we can treat the whole endometriosis, sort out the endometriosis as well as trying to get you pregnant. So you get the point. It kind of works hand in hand, but it's not mutually exclusive. That's too serious. It just means you can have endometriosis and be able to have babies. You can have endometriosis and need help to have babies. Simple. Now, what else? There are instances where it's so bad and you want to even take out. Some people say, okay, please take out my womb, take everything out. It doesn't mean it's going to cure it permanently. So the point is, the earlier you find out what it is, do your basic, see your doctor, they get you evaluated. The earlier you're managed, the better for you in terms of its progression. But I know there are people listening to me right now and you already know you have endometriosis. There are a lot of things that can be done to manage your pain. In fact, sometimes you may need to go to a pain therapist. You can try, other ways of managing the pain that comes from the process. So it's a lot to handle sometimes, but I would say come in, see your doctor, and get yourself evaluated to find out what stage of the disease you have and give you a tailor-made treatment. So I would say that endometriosis can be managed. Can it be cured totally? There's no never in medicine, but I would say this simply. If you have endometriosis already, if you don't know why you're having excessive abdominal pain, when you're having your menses. That's increased cramping, pain on defecation, pain when you're eating yourself, bleeding for other parts of your body during menses. You should see your doctor. That's you just have to see your doctor, your gynecologist, and if you're going to be referred by your GP surgery, you should definitely see your doctor for a referral. And it can be managed in terms of your pain management, your medications to help to reduce, to halt the growth of these cells going outside your womb, surgeries that can be done, intervention that can be done to to manage, like you have it growing on your ovaries, something like an endometrioma. There are things to be done, so just have to see your doctor and get it managed. And I would say for those who already are diagnosed with endometriosis, I can imagine how tough it could be, but you know what, we're going to win at this. So see your doctor and get something done. Don't give up on making sure that you see to the end of it. And if you're trying to conceive, you were told you have endometriosis, it's okay. That can also be managed by a doctor. So make sure that you don't give up on, I have endometriosis and I can't have a baby. No, it doesn't work that way. You can't have your own babies. So make sure that to do something about it. If this was helpful, let's know in the comment section. Give us a thumbs up if you like what you're hearing. And let's know if there are other questions you want to ask about endometriosis or you want us to talk about in our next video. For now, I would say bye. So subscribe to our channel, turn on your notification buttons for new videos, and we'll see you later. Bye.